Health correspondent Nicola Hill, who is in London. Nicola, this is really interesting. I was reading about this earlier, and I was particularly struck by a number out of the U.S. where there were recorded only 36 flu cases in the entire country for 1 week in December. And by comparison, a week last year at that same time, there was something like 7,700 cases. So what more can you tell us about this?
It's quite interesting, isn't it? And we've seen similar figures in both sides of the hemisphere. Certainly here in the UK, there's been, compared to the past 5 years, the numbers of flu cases are much lower. The main deaths, obviously, COVID-19, 3 times as many deaths from COVID than there have been from flu and pneumonia. They link the two together. And in the southern hemisphere, their winter, which was during our summer, there was something like 80 deaths from flu and pneumonia compared to over 300 the previous year. But Rachel, it's like you say, really, it's because of the social distancing, the wearing of masks, the increasing hand hygiene, not shaking hands, not kissing people when you meet them. All these restrictions that have been put in place to help prevent the spread of the coronavirus have inevitably also helped prevent the spread of flu and colds and coughs and everything like that. You know, many friends of mine have certainly said that they've not been ill this winter, whereas normally they've certainly been stuck in bed with a bad cold or flu. Now, there definitely was a lot of concern about this twindemic, and that's why there's been a real ramping up and encouragement of people to get the flu vaccine. Certainly, Professor Paul Hunter from the University of East Anglia said they were very concerned because, of course, they're both respiratory illnesses. COVID-19, we know it affects more than just the lungs, but it is at the beginning a respiratory illness, as is flu, which comes on to be pneumonia. And that's why there was this real concern that if people got both at the same time, even if they just got mild cases of both, it could kill them. Now, there's been quite a lot on social media today with people saying, oh, I'm being invited for my flu vaccine. If you've got time to give a flu vaccine, why don't you give me the coronavirus vaccine? But of course, it's because a lot of people are eligible for the flu vaccine who won't get the coronavirus vaccine for a long time, months, you know, in the future. So that's why they are still encouraging people, you know, prevent the flu, because you don't want to be down with flu, potentially pneumonia, have to go to hospital with that, and then end up with COVID-19.
Yeah, that certainly would be very bad. You know, Nicola, something else that's I've also been wondering is about all these measures that we're taking to protect ourselves, such as social distancing, not shaking hands, as you mentioned, and sanitizing. Is there concern that that could actually be damaging our immune systems? Because aren't in some way germs good? And in particular, children, because I know young children, their immune systems take time to develop, but if they're not outside playing and around other children, could they see long-term effects from that?
Yeah, it's something that quite a few people are concerned about. Certainly, you know, we're protecting ourselves, we're cleaning ourselves. Is this actually going to damage us? The short answer to that is no. So I checked this with Dr. Simon Clark, who's a microbiologist at the University of Reading, and he said there are still plenty of germs around that we are coming into contact with, particularly if you have animals and if you have children. Because he said both of them are dirty. You're right, you know, children not being able to play outside, and perhaps any single child in a hermetically sealed environment probably is less likely to come into contact with a germ, but there are so many germs around and our bodies are coming into contact with them. He said what people are more concerned about and are more likely to be afflicted by is the dryness of skin and therefore getting a dermatitis. Because we're washing our hands so much, we're stripping away the oils in our hands. And of course, the main answer to that is putting on a barrier cream. The other thing that lots of people are concerned about is a word called acne, and it's spots you're getting from constantly wearing a mask, you know, also causing a rash or something like that on your face. And again, one of the main problems with that is people wearing the same mask for too long. It's a conversation you and I have had before, Rachel, the need to ensure that you change your mask. You know, if you take it off, don't put that one back on again, because then you are obviously spreading germs back onto your face. Now, the CDC, the Centre for Disease Control in America, has also put out something telling people don't worry about using hand sanitizers and they recommend they should be 60% alcohol, having any effect on antibiotics, which is another thing people have been concerned about. That's not the case. It's not going to cause antibiotic resistance. So, you know, carry on being clean to prevent COVID-19. Don't worry that, you know, having to do this now is going to have a long-term effect on your immune system.
All right, great to know. Keep washing our hands and using the hand sanitizer. And here in Turkey, we have the colonia, which is also really good for killing germs. Nicola, thank you.